Here at the Birmingham Women's Hospital, 8,200 new babies are born each year. However, for many couples, they don't reach this point, as many pregnancies sadly end before the birth of a new child. 1/4 of pregnancies end in miscarriage. This is when a woman becomes pregnant, but sometime between conception and the 24th week of gestation, the embryo dies, so a baby is never born. 85% of these are in the first trimester. Often women feel as though they are to blame for the miscarriage because as they have become pregnant, the sperm has done its job fertilising the egg, so they think that it can't have anything wrong with it. But this isn't always the case. 60% of miscarriages can be attributed to either sperm or egg problems. These are often known as chromosomal abnormalities, meaning either too much or too little information is passed on to the new embryo so it doesn't grow properly. However, 40% of miscarriages are actually due to something wrong with the sperm DNA, meaning it hasn't got the right information to code for the embryo. This can cause problems at any stage, from early development in the womb, by coding for the wrong processes, meaning the embryo doesn't grow properly, leading to a miscarriage. Any sperm cell can have DNA damage. This means that the genetic material that is used to code information needed to help the baby grow and information about the baby's characteristics is either damaged or broken, so the baby doesn't form properly. Normally, to get pregnant, the sperm travel up the uterus to where the egg is found. The sperm and egg then combine and form the embryo, which will then grow into a baby. Sometimes a sperm with damaged DNA will fertilise the egg, and the woman will become pregnant, but when this happens, the embryo may not grow properly and cause problems at a later stage in pregnancy. This is something called the late paternal effect. At first, the pregnancy may seem normal because lots of the initial processes to build the embryo are controlled by the egg. The embryo grows and cells change shape as they develop to carry out different functions. Later on, information from the sperm is needed for the growth of the embryo, but if this information is incorrect, the embryo is built in the wrong order or with the wrong pieces. The embryo therefore doesn't have the right features to allow it to develop into a healthy baby, so it signals the uterus to say the pregnancy cannot carry on, resulting in a miscarriage. All sperm samples from any man will have some DNA damage, but as these levels increase, their overall sperm quality decreases, and it is more likely one of these sperm with DNA damage will fertilise an egg and cause a miscarriage. There will be some sperm DNA damage in all samples from any man. DNA damage can be caused by things you can't control, like air pollution, your age, treatment you've had in the past for cancer, or infection. It may also be because of lifestyle factors, like smoking, drinking excessively, obesity, and having an unhealthy diet. When a couple has experienced multiple miscarriages after conceiving naturally, doctors may look into the quality of sperm DNA because this could be the reason for the problem. As the couple has been able to get pregnant, fertility treatments will be no use because the problem comes on later in the development of the embryo. There are tests available that can look into whether a sperm sample has more DNA damage than normal. This can be used to diagnose infertility in a male, but they're not useful in selecting a healthy sperm to be used in fertility treatments because the processes end up killing the sperm at the end of the test. These tests are also expensive and difficult to carry out, and there isn't really very much in the way of treating men with high levels of DNA damage in their sperm, so this is something the research group are wanting to look into. The research group is looking into ways to show the link between multiple miscarriages and high levels of sperm DNA damage. They want to work out which is the best test to use to diagnose someone with high sperm DNA damage, and they also want to develop one that can be used more easily and more cheaply. They will then use the information from these tests to work out who might benefit from therapy. They're hoping to reduce miscarriage rates after natural conception by improving DNA quality in sperm. At the moment, there are recommended lifestyle changes that someone with high levels of sperm DNA damage can implement to improve sperm quality. These include drinking less alcohol and stopping smoking, losing weight and improving the diet, for example, by eating at least 5 portions of fruit and vegetables a day. The research group are hoping to show that taking a vitamin supplement will prevent DNA damage during sperm development and aid in improving overall sperm quality. A trial to look into this is going to start in January to work out if taking these supplements actually does improve sperm DNA quality. If the trial is successful, these vitamin supplements could then be used by doctors in the future to treat someone who has sperm DNA damage and then therefore reduce the rates of miscarriage after natural conception.